Hi, I'm Dr. Jodi Schoenhaus, and I practice foot, ankle, and leg vein reconstruction in Boca Raton, Florida. I grew up in Philadelphia, went to University of Michigan, and then Temple University for medical school, at which time I did a surgical residency in foot and ankle reconstruction before moving to Florida, where I established and grew from the ground up the Foot, Ankle, and Leg Vein Center, focusing on attention to detail, customer service oriented, and evidence-based medicine practice on foundation of mechanical properties of the foot and ankle with aesthetic finishing touches. So I got into foot and ankle surgery basically as a child. I grew up going into the operating room with my dad. Anytime I had a day off from school, he would wake me and I would love to go into surgery. I just love the human body, love learning all about science. Really, I got into foot and ankle because of him. He is a foot and ankle surgeon who was almost a forefather of our surgical reconstructive board, advanced technologies and techniques that we perform today. It was just so fascinating to learn, frankly, from one of the best. I've never seen a surgeon with better hands until I met my husband, who is also a foot and ankle surgeon. We met our first year of school. And it was interesting because when we were deciding where to practice, I had this big inner city Philadelphia practice to go into, but decided it really wasn't me. And I had to look introspectively to say, do I want to go into practice with my father, which would have been amazing, or start my own career, which is when my husband and I, who I mentioned is also a foot surgeon, we decided to move to Florida and start our own practice. Ironically, a few short months later, my dad did follow, so it was very nice because we have the family time in Florida, and then I really do have a practice that suits me. So it is very nice because I have the foundation and that legacy of learning from my father, who is very well respected and well known in our community. But I've taken my own thoughts and projected it into newer techniques of today, regenerative medicine, and adding aesthetic principles to that mechanical foundation. I started using regenerative techniques in foot and ankle principles of surgery and conservative care back in residency in early 2000s when PRP first came on the scene. We were doing blood draws in the operating room and spinning it down to obtain good PRP. Now it's just the start, right? Years later, tons of clinical evidence and research has really proven that these regenerative techniques can help in an office setting. So much of what I see with patients is they're looking for non-surgical alternatives, finding conservative care options, yet the surgical options are sometimes really needed. So we have this spectrum of very conservative or surgical. I find where regenerative techniques come into play are this intermediary solution to provide to the patient to say, you've had this condition a long time, you may need surgery in the future, but let's try these newer techniques. I have found Tulip Medical, which has been an amazing introduction to my practice, in two main ways. One, they have a centrifuge that works perfect for my PRP, and I like to provide PRP injections for soft tissue. I like to integrate PRP in my soft tissue modalities for plantar fasciitis, Achilles tendinosis, and other soft tissue injuries for stimulation of collagen formation, help healing, and decreased inflammatory benefits long term. As another benefit, Tulip has a nanofat kit, and they have these instruments that have been perfect fit in my practice for fat transfer. I use a lot of fat grafting for offloading of high pressure areas in the foot, people who have traumatic injuries or other pathologies where they have such high pressure, such pain with walking and activities that their quality of life is really diminished. By adding their own fat and transferring fat into these high pressure areas, we are able to provide more pain-free ambulation through cushioning, decreasing pressure load. Tulip makes the perfect instrumentation for me to harvest the fat, produce nanofat, and inject it into the high pressure area so that we get stimulation of new fat formation and even that stem cell technique of regeneration to really enhance and improve on foot function. When we do the fat pad restoration to the foot, there is a curve that I have found and actually show patients a chart that immediately upon injection, you feel almost a plump action, that it's really a cushion benefit. And then over the course of 2 weeks, I have them offloaded or limited weight bearing so that we don't lose or kill that fat with the pressure force of walking. But during that period, a certain part of the water portion gets resorbed so that cushioning effect diminishes slightly. And then over the course of 12 weeks, we have found an increase of that cushioning effect re-stimulated. That is through adipogenocyte formation, and those growth factors are really being brought together to stimulate new formation of tissue and produces more building of that thickness and quality of that cushioning in the subcutaneous layer that is needed when walking. So by 12 weeks, patients are at that optimal benefit, finding it lasting as a plateau from about 12 weeks to anywhere between 3 to 5 years before it starts to diminish, and then they need a touch-up. Again, we're not changing the mechanical forces on the foot, and we don't walk on our face, right? So we have to consider that as a very important layer of treatment. Weight bearing adds a whole other dimension to the fat grafting. So post-procedure, upon grafting of the fat to the foot, we use offloading techniques, whether it's localized padding or a post-op offloading shoe. So if I'm doing the ball of the foot, there's a special shoe where you just walk on the heel, no weight on the foot, and vice versa for the heel. So if I'm supplementing the heel, patients just walk on the ball of the foot. And they do that for anywhere from 2 to 4 weeks, followed by gentle weight bearing in a sneaker and limitation of activities for approximately 8 to 12 weeks. Higher impact after 12 weeks. Fat grafting technique to the foot is life-changing for a lot of them. So much of what fat grafting is aesthetic. But we are getting patients and seeing people functionally who have such a diminished quality of life. They can't even stand barefoot in their shower. It's just so painful. Whether it's post-cortisone-induced lipoatrophy from multiple injections, whether it's traumatic fractures and problems that required surgical reconstruction, or traumatic amputations, diabetic ulcerations, and the healing process for that. The fact that we can take fat and supplement to these areas has changed people's quality of life significantly. Considering the fact that you have a diabetic ulcer that you can offload through these grafting techniques that diminishes the chance of a diabetic amputation, it's a huge change to somebody's quality of life. Or even the professional athlete who, believe it or not, a great example, a professional tennis player I had just performed the procedure on, and what they would do is every time they would have a lateral move on the court, the outside and bottom of their foot would impinge on the outside of their foot, causing significant pain and pressure in the foot. By just contouring and doing the fat grafting, it takes that pain stimulus out of the play factor on the court, and thus their inhibition is gone. They don't have the pain, and they don't have that, am I going to get the pain? And it improves upon their game. Or just the older woman who has significant loss of padding and atrophy due to age, who just can't even barely wear shoes and is almost walking in her home on whatever cushion foam she can wear, would like to just walk and play with her grandchildren who can't. By doing the fat grafting techniques, the quality of life is drastically improved. And I'm not saying this is the magic wand that's going to take somebody's pain level from an 8 and 10 down to a 1 or 2. But if we can improve pain by 60, 70, 80% for 3 to 5 years before they need a touch up, to people, that's a game and life changer, really. So foot fat grafting is something that within the past 3 years has really gained attention. Is it the consumer looking for options? Is it the practitioner now having resources to provide more options? A combination of both. But there is still a need. I wish I could scream with a huge megaphone across the country, there is an option for all of you people. But some people just don't even know what to ask, what to research on Google, and doctors don't even know that it is an option. But we are slowly spreading the word. And I think within 10 years, this is going to be an extreme game changer, not only for the diabetic ulcer wound care industry, but just for the foot and ankle industry as well.